Spencer technique of the shoulder has following components: extension, flexion, circumduction with compression, circumduction with distraction, abduction, adduction, internal rotation, and traction stretch. Many use this technique to increase range of motion of the shoulder joint. In this class, we're going to use this technique to treat glenohumeral somatic dysfunction by adding muscle energy in between these stages. Spencer technique starts with extension. Patient is on his or her lateral recumbent position with the affected side up. Doctors are using his or her cephalad hand to stabilize the scapula and mobilize the humerus into extension position. If the patient has flexion of the glenohumeral joint as a somatic dysfunction, you can actually treat that somatic dysfunction here in extension by engaging the extension barrier and doing muscle energy. Smaller practitioners, you can actually have your patients rest his or her forearm onto your forearm so that this allows you to stabilize the humerus a lot better in flexion and extension, and later abduction and adduction if you like. Notice also here that I'm using my palm to push down onto the scapula since I am not able to grasp the entire scapular region with my palm. Second step is flexion. Again, using your cephalad hand, grasp and stabilize the scapula and move the humerus into flexion until the barrier is met. If there is a restrictive barrier here, you can perform muscle energy to treat that. Step 3 is circumduction with compression. Your patient's humerus should be abducted and the elbow should be flexed. You can use your palm to compress the humerus into the glenoid, and your cephalad hand still should be stabilizing the scapula. Then move the humerus in circular motion, first in one direction, then you can change the direction to the other direction. Start with smaller circles, then progress to larger circles. Number 4 is circumduction with distraction. Bend the patient's elbow, then apply a gentle traction on the humerus away from the glenoid. With this traction, still stabilizing the scapula with your cephalad hand, you should start making small circular motions. First in clockwise direction, then you can change to counterclockwise. Start with small circles, then move on to bigger circles. If you're able, you can actually do circumduction with distraction in a different way. In this version, elbow is extended and distraction is achieved by pulling on the wrist. This version may require a little more power. Next step is abduction. Using your cephalad hand stabilizing the scapula, we're going to have your patients lace over your forearm and you're going to contact the patient's elbow and move the humerus into full abduction until the barrier is felt. If there is a restrictive barrier, you can perform muscle energy here. Next step is adduction with external rotation. We're going to stabilize the patient's shoulder and scapula, and then we're going to have our patient's hand laced over our forearm in the same exact position as abduction, and then we're going to push down on our patient's elbow to induce external rotation and adduction. Next step is internal rotation. Place the patient's dorsum hand on the patient's back to create internal rotation. Shoulder is stabilized with the caudal pressure and slowly pull on the elbow to increase the amount of internal rotation. This extreme internal rotation position is often very sensitive for patients, so please be careful and make sure that your patient is not in pain. Traction stretch is the last of the Spencer technique. Put your patient's arm on your shoulder and then contact the proximal humerus with the pads of your fingers, grasping the arm. There, palpate to the glenohumeral joint. Apply longitudinal stretch, moving all around the shoulder capsule.